Good morning, everyone. Dr. James Whitaker here. And today we're going to talk about something that most men over 50 experience, but almost nobody wants to discuss openly. You've probably noticed that things just don't work the same way they used to, especially down there. What was once automatic, something you never even had to think about, now seems to require concentration, effort, and sometimes, no matter what you do, it just doesn't happen at all. Blood flow seems weaker, sensitivity has faded, and that rock-solid reliability you once took for granted feels like a distant memory. For most men, this is where resignation kicks in. You tell yourself this is just part of getting older. It's inevitable. There's nothing you can do about it. Maybe you've tried the little blue pill, and while it works sometimes, you're always left wondering about the side effects or feeling dependent on a chemical just to feel like yourself. But what if I told you this decline isn't an inevitable life sentence? What if there was a simple physical trigger point on your own body that you could activate in just 60 seconds a day to begin systematically restoring that youthful function? Before we dive into this technique, if you're new to this channel, welcome. I'm a board-certified physician who spent over 2 decades helping men reclaim their vitality and confidence. If you find value in what we discussed today, please hit that subscribe button and turn on notifications. What I'm going to share with you is a technique that doesn't involve prescriptions, weird gadgets, or expensive treatments. It's based on the fundamental mechanics of how your body's designed to work, no matter your age. Just last month, a 68-year-old patient named Michael came to see me after struggling with erectile difficulties for nearly 3 years. He tried medication with limited success and was beginning to accept that his sex life was essentially over. I taught him the exact technique I'm going to share with you today, and when he came back 6 weeks later, he told me he felt like he'd regained a part of himself he thought was gone forever. His morning erections had returned, his confidence was restored, and his relationship with his wife had deepened in ways he hadn't expected. To understand why this technique is so powerful, you first have to understand what's really happening when erectile function starts to decline. It all comes down to two very simple, very physical things: robust blood flow and clear nerve signals. A powerful, lasting erection is the result of your brain sending a clear signal that tells your blood vessels to open up, allowing a surge of blood to flow into the penis and stay there. When you were younger, this system was flawless. Your circulatory pathways were wide open, flexible, and efficient. Your nerves fired off signals with perfect clarity. But as the years go by, two things happen. First, the entire circulatory system, especially the fine network of vessels in the pelvic region, starts to lose its youthful flexibility. Think of it like a new garden hose versus one that's been sitting out in the sun for 20 years. The old hose gets stiff, brittle, and its flow becomes restricted. The same process happens on a microscopic level in your body. But there's a second, more important factor at play here, and it's the one that almost nobody talks about. Not even most doctors during appointments about erectile dysfunction. It involves a critical group of muscles that form the very foundation of your sexual function, your pelvic floor muscles. Imagine a muscular hammock or sling stretching from your tailbone to your pubic bone. This is your pelvic floor. It supports your internal organs, controls your bladder, and most importantly, it's directly responsible for managing the blood flow that creates and sustains an erection. It's the muscle you instinctively clench to hold back urination or to achieve that final push during ejaculation. Just like your biceps or quads, the pelvic floor is a muscle, and like any muscle that isn't properly maintained, it begins to weaken and lose function over time. This isn't just a minor issue, it is the absolute foundation of the problem we're here to solve today. Let me know in the comments below what country you're watching from. I'm always fascinated to see how men from different cultures approach these conversations about sexual health, and your comments help me understand how to serve this global community better. Here's where things get really interesting, because the problem with the pelvic floor isn't as simple as it just getting weak. It enters a paradoxical state where it becomes both weak and chronically tense at the same time. That might sound contradictory, so let me give you a simple analogy. Imagine an old rubber band that's been stretched around a stack of papers for 10 years. When you take it off, it's still tight and rigid, stuck in that tense position. But does it have any strength? No. If you try to stretch it and let it go, it doesn't snap back with any force. It's weak, it has lost its power and elasticity. This is exactly what happens to your pelvic floor muscles over decades. They become chronically tense from years of poor posture, stress, and especially from sitting for long hours in office chairs and cars. This constant low-level tension becomes their default state. They are perpetually switched on, tight, and rigid. But because they're always tense, they lose their ability to contract powerfully when you actually need them to. They've become weak in their functional strength. This tense yet weak state creates a devastating 1-2 punch that sabotages your erections. First, the chronic tension acts like a clamp on the very blood vessels that need to open up to allow blood to surge into the penis. Think of it as a massive traffic jam right at the most critical intersection in your body. The highways are there, but the constant tension is squeezing all the lanes, preventing traffic from flowing freely. So when your brain sends the signal for an erection, the blood simply can't get there in the volume or with the force it needs to. Second, this same muscular tension physically compresses and pinches the delicate network of nerves that run through the pelvic region. These are the nerves that carry the signals of arousal and pleasure from your brain to your penis and back again. When they're compressed, the signal gets muffled and distorted like a bad radio connection. Sensation is dulled, and the command from your brain to initiate and maintain an erection becomes weaker and less effective. So you're facing a double problem: restricted blood flow and muffled nerve signals. It's no wonder that erections become less firm and harder to maintain. This isn't a failure of your manhood. It's a simple mechanical problem, like a plumbing and electrical issue. Michael, the patient I mentioned earlier, described his experience perfectly. He said it felt like his body wanted to respond during intimate moments with his wife, but something was physically blocking the signals. That something was the chronic tension in his pelvic floor, combined with reduced blood circulation to the area. Once we addressed this mechanical bottleneck, everything changed for him. So if the problem is a mechanical traffic jam in your pelvic floor, then the solution has to be mechanical as well. It's not about adding more chemicals to the system. It's about clearing the road, opening up those pathways, and restoring proper function. And fortunately, your body has a master switch, a central hub that allows you to do just that. For thousands of years, practitioners of Eastern medicine have known about a specific spot on the male body that is so critical to vitality, energy, and sexual function that they nicknamed it the $1,000,000 point. They understood that this small area was a powerful gateway to the body's core energy systems. In modern anatomical terms, this spot is known as the perineum, and it is, without a doubt, the most important piece of real estate on your body when it comes to erectile health. So where is it? It's the soft, fleshy area located precisely between the base of your scrotum and your anus. Now, why is this tiny patch of skin so incredibly powerful? Because it's the anatomical grand central station for your sexual function. It's the exact point where the most critical systems converge. The major blood vessels that feed the penis pass directly through or near this area. The essential nerves that control erections and sensation, particularly the Pudendal nerve, are bundled together here. The very root of the penis itself is anchored internally right beneath this spot, and it serves as the gateway to the prostate gland, which plays a vital role in ejaculation and sexual pleasure. When you apply pressure and massage to this specific point, you're not just rubbing skin. You're sending a direct signal to this entire interconnected network. You're physically stimulating blood flow, breaking up the muscular tension that's been clamping down on your arteries for years. You're waking up the compressed nerves, allowing those crucial signals for arousal to travel loud and clear, and you're encouraging the deep foundational muscles of the pelvic floor to finally release their chronic tension. Massaging this point is like sending in a team of expert traffic controllers to clear up that central intersection, allowing vital energy and blood to flow freely once again. It's the single most direct and effective way to physically address the root cause of age-related erectile decline. I've been teaching this technique to patients for years, and the consistency of positive results never ceases to amaze me. Men who thought their problems were purely hormonal or vascular discover that a significant component was actually neuromuscular, something they could directly influence through this simple daily practice. So let's get right into the technique itself. This is something you can do in just 60 seconds, And it's incredibly simple. The key is consistency, making it part of your daily routine, just like brushing your teeth. First, you need to find a comfortable position that gives you easy access to the area. For most men, there are two simple ways to do this. You can sit on the edge of a chair or your bed, lean forward slightly, and reach down between your legs. Alternatively, you can lie on your back, bend your knees, and let them fall open to the sides, which also provides clear access. The goal is simply to be relaxed and able to reach the spot without straining your arm or shoulder. Next, let's pinpoint the exact location. You're looking for the perineum, that area of soft tissue between the base of your scrotum and your anus. Take your index finger and middle finger together and gently begin to press into that area. You're not looking for a bone or hard muscle, but rather a slightly softer, more yielding region right in the center. As you gently probe, you may find a spot that feels slightly more tender or sensitive than the surrounding area. That's actually a good sign. It means you found the spot where a lot of that tension is being stored. Some men report feeling a slight electric sensation or tingling when they first find this point. That's the pudendal nerve responding to the pressure, and it's completely normal. It actually confirms you found the right location. Now let's talk about pressure because this is crucial. You're not trying to cause pain. The correct pressure is firm but gentle and comfortable. A good way to gauge it is to imagine you're pressing on a ripe avocado to check if it's ready to eat. You want to apply enough pressure to feel that you're engaging the tissue beneath the skin, but not so much that it hurts. If you feel any sharp pain, you're pressing too hard and you need to ease up immediately. This should feel like a relieving, therapeutic pressure. Once you've found the spot and have the right pressure, the motion itself is a simple two-part process that takes just 1 minute. For the first 30 seconds, you're going to make slow, deliberate circular motions in a clockwise direction. Keep the pressure consistent and focus on the sensation of releasing tension in that central point. Imagine you're smoothing out a knot in a tight muscle. Some men find it helpful to count in their head, 1,000, 2, 1,000, to ensure they're actually spending the full 30 seconds rather than rushing through. Then after 30 seconds, you're going to reverse the direction. For the next 30 seconds, make the same slow, deliberate circular motions in a counterclockwise direction. This directional change is important because it ensures you're working the tissue from multiple angles, releasing tension patterns that might have developed in different directions. And that's it. 1 full minute, 30 seconds clockwise, 30 seconds counterclockwise. That's the entire core of the technique. This simple daily ritual, when performed consistently, is what begins to systematically dismantle that pelvic traffic jam, restore healthy circulation, and reawaken the nerve pathways essential for strong, reliable erections. Now, you can absolutely perform this technique with just your fingers on dry skin, and you'll still experience benefits. But if you want to supercharge your results and make the entire process more effective and far more comfortable, I highly recommend using a therapeutic oil. Using an oil does two important things. First, it provides lubrication, allowing your fingers to glide smoothly over the skin, preventing friction and irritation. This makes the massage more comfortable and allows you to maintain consistent pressure without any drag. But the second benefit is the real secret here. Because the right kind of oil does more than just lubricate. Certain natural oils contain powerful therapeutic properties that are absorbed through the skin and work in synergy with the physical massage to amplify the effects. My number one recommendation for this purpose is high-quality, cold-pressed castor oil. There's a reason this oil has been used for centuries in traditional healing practices all over the world. Castor oil has a unique molecular structure that allows it to penetrate deeper into the skin and tissues than almost any other oil. When you massage it into the perineum, it doesn't just sit on the surface, it's absorbed and goes to work on a deeper level. Castor oil is renowned for its ability to stimulate circulation and promote lymphatic drainage, which helps flush out stagnant fluids and reduce inflammation in the pelvic region. This is precisely what we want to achieve. It actively helps the body dissolve the blockages you're physically working on with the massage. The lymphatic system, which is responsible for waste removal and immune function, doesn't have a pump like the cardiovascular system has the heart. Lymphatic fluid moves through compression and movement. When pelvic floor muscles are chronically tight and immobile, lymphatic drainage from the genital area becomes sluggish, contributing to chronic low-grade inflammation and congestion in the tissues. By massaging the perineal area with castor oil, you're manually encouraging lymphatic flow, while the oil's anti-inflammatory properties work from the inside. If you can't find castor oil or prefer something different, my second recommendation is organic extra virgin coconut oil. Coconut oil is an excellent alternative, especially if you have more sensitive skin. It's also incredibly well absorbed and contains natural anti-inflammatory and antimicrobial properties. Plus, for many men, it has a more pleasant and subtle scent than castor oil. Whichever oil you choose, here's a simple tip to make it even more effective. Before you apply it, pour a small amount, about the size of a quarter, into the palm of your hand. Then briskly rub your hands together for about 10 to 15 seconds to generate some warmth. Applying the oil warm does two things. It feels much more pleasant on the skin, and more importantly, the warmth helps open up your pores, allowing the oil to be absorbed more quickly and deeply into the tissues. This simple step turns a basic massage into a deeply therapeutic treatment, combining physical stimulation with the natural healing properties of the oil. I recommend keeping your chosen oil in the bathroom with your other daily essentials. If it's stored in another room or tucked away in a drawer you never open, you'll forget to use it. Accessibility is a key factor in habit formation. Make this as easy as possible for yourself so it becomes automatic. Before you start this practice, I need to be very clear about two common mistakes that can completely sabotage your results. The first and biggest mistake is using too much force. There's a tendency, especially for men, to think that if a little pressure is good, then a lot must be better. That is absolutely wrong here. Remember, you're dealing with a sensitive area full of delicate nerves and blood vessels. This is not a deep tissue sports massage. If you feel any sharp pain, or if the area is sore the next day, you went too hard and you need to scale back significantly. The pressure should be firm but gentle. Pain is your body's signal to ease up. The goal is to coax the muscles to release their tension, not to force them into submission. When tissue is approached gently and consistently, it responds by relaxing and opening up. When it's approached with too much force, it actually guards and tightens defensively, which is the exact opposite of what we're trying to achieve. The second major mistake is impatience. Many men try this for a few days, don't see an overnight miracle, and simply quit. You have to understand that this is not a magic pill that works instantly. The tension in your pelvic floor took decades to build up. It's not going to vanish in 72 hours. Think of it like going to the gym. You don't do one workout and expect to see bigger biceps the next morning. Results come from consistent daily practice over weeks and months. The same principle applies here. Your body needs time to remodel tissue, retrain neuromuscular patterns, and establish new default states of relaxation and function. So what's a realistic timeline for seeing results? Based on my clinical experience with hundreds of patients over the years, most men start to notice subtle improvements within the first 1 to 2 weeks. These might include better morning erections, increased sensitivity during the day, or stronger pelvic floor awareness. The more significant, reliable, and lasting changes to your erectile firmness and duration typically become apparent after about 30 days of consistent daily practice. By 90 days, you should have a very clear sense of how much this technique is helping your specific situation. Michael's experience followed this exact timeline. After about 10 days, he noticed his morning erections returning at about 50% of their former strength. By the 1-month mark, he reported that he could achieve and maintain erections during intimacy with much less effort and anxiety than before. At his 3-month follow-up, he told me this simple practice, combined with some dietary changes we'd also implemented, had given him more improvement than 2 years of sporadic medication use. The key word in all of this is consistency. Doing this technique 3 times in the first week, then forgetting about it for 5 days, then doing it twice the next week gives you essentially no benefit. The therapeutic effect depends on regular, sustained mechanical stimulation. If you can't commit to daily practice for at least 30 days, I'd rather you not start at all. That might sound harsh, but I'd rather be honest with you than give false hope. This works, but only if you work it consistently. Now let me give you some practical advice for building this into your daily routine in a way that actually sticks. Behavior change research tells us that habit formation requires three elements: a clear trigger, a simple action, and a reward. The trigger for this practice should be something you already do every day without fail. For most men, that's the morning shower. So the protocol becomes finish shower, dry off, apply warm oil to hands, perform 60-second massage. The action is simple and time-bound, exactly 60 seconds. The reward is the immediate feeling of having done something positive for your health, plus over time, the improvements in function that reinforce the habit. Some men like to track this practice on a simple calendar or habit tracking app. Put an X for each day you complete the technique. This creates a visual chain of success that motivates you to keep going. After about 3 weeks of daily practice, it becomes automatic, something you do without having to remind yourself. I also want to address something that might be uncomfortable for some viewers, but needs to be said. The perineal area, because of its location between the scrotum and anus, carries some social stigma or embarrassment for many men. There's an association with anal anatomy, and some men have internalized messages that make touching this area feel wrong or shameful. I want to be very clear about this. Taking care of your body, all parts of your body, is not shameful, weird, or anything other than responsible health management. The perineum is part of your anatomy. It has specific physiological functions, and working with it therapeutically is no different than massaging a sore shoulder or stretching a tight hamstring. If you find yourself having strong resistance to trying this technique, it might be worth exploring where that resistance comes from. Sometimes our barriers to better health are psychological rather than physical, and recognizing that can be the first step toward overcoming it. I also want to mention that pelvic floor physical therapists use techniques very similar to what I'm describing here. They're trained in internal and external pelvic floor work and can provide even more targeted treatment if you need it. Many men don't know that pelvic floor physical therapy exists or that it's a legitimate, evidence-based treatment for erectile dysfunction, premature ejaculation, urinary incontinence, and chronic pelvic pain. If you've tried this technique consistently for 3 months without significant improvement, asking your doctor for a referral to a pelvic floor physical therapist would be a smart next step. These specialists can identify specific muscular imbalances or tension patterns that might need more individualized treatment. Insurance often covers these services, especially if you have a diagnosis. It's not something to be embarrassed about. These therapists work with these issues every single day and approach them with complete professionalism. Let me share another patient story because it illustrates an important point about comprehensive care. David was 61 years old when he came to see me, dealing with progressively worsening erectile function over about 4 years. He'd tried medication with partial success, but wanted to explore non-pharmaceutical options. I taught him this perineum massage technique along with several other interventions, including dietary modifications to increase his intake of foods rich in nitric oxide precursors like leafy greens, beets, and pomegranate, as well as a simple walking program of just 20 minutes daily. After 8 weeks, David reported that his erections were noticeably firmer and lasted longer, but he wasn't sure which intervention was responsible. I explained that it didn't really matter. All of these practices work synergistically, supporting blood flow, reducing inflammation, optimizing hormonal balance, and improving neuromuscular function. The massage technique was one important piece of his recovery, not the entire solution by itself. That's the approach I want you to adopt as well. View this 60-second daily practice as a valuable tool in your overall men's health strategy, not as a magic bullet. There's also an interesting connection to ejaculatory control worth mentioning. The same pelvic floor muscles we're working on with this technique are the ones involved in controlling ejaculation. Men who practice this massage regularly often report not just better erections, but also more control over ejaculation timing. This makes sense anatomically because these muscles need to coordinate properly between contraction and relaxation. When they're chronically tense, that coordination is disrupted, leading to either premature ejaculation or sometimes delayed ejaculation. By restoring proper muscle tone and function through this daily practice, many men find that their ejaculatory control improves as a secondary benefit. This was actually what happened with Michael. While his primary complaint was erectile difficulty, he mentioned at his follow-up that he'd also noticed he had much better control over when he climaxed, something he hadn't even thought to mention initially because he'd adapted to it over the years. Now, I want to address the role of mindset and belief in sexual function because this is critically important. There's substantial research showing that placebo effects are particularly strong in sexual medicine. If you believe a treatment will help, that belief alone can improve outcomes, likely through reduced performance anxiety and increased confidence. Now, I'm not saying this technique is just a placebo. The physiological mechanisms I've described are real and evidence-based. The perineum is genuinely the anatomical hub for sexual function, and releasing muscular tension in this area does improve blood flow and nerve signaling. However, approaching this practice with a positive expectation rather than skepticism will likely enhance your results even further. Your brain and body are not separate systems. Your thoughts and beliefs directly influence hormonal release, blood flow patterns, and neuromuscular tension. So as you begin this practice, consciously cultivate the expectation that this will help. Visualize improved function. Notice and celebrate small improvements rather than fixating on what's still not perfect. This mindset work is just as important as the physical technique itself. Michael's final follow-up, about 4 months after he started this practice, was one of the more rewarding moments in my recent clinical work. He told me that he and his wife had experienced renewed intimacy and connection that he thought was permanently lost. He'd stopped obsessing over erectile performance because his function had improved to the point where it was no longer his primary concern during intimate moments. He described feeling more present, more able to enjoy the experience rather than being stuck in his head worrying. That psychological shift, moving from anxiety to presence, often happens naturally when the physical function improves. It's a positive feedback loop. Better function reduces anxiety, which further improves function, which further reduces anxiety. Breaking into that positive cycle is often the hardest part, and sometimes a simple physical practice like this massage technique is exactly what's needed to initiate the shift. Before we wrap up, I want to give you one more piece of practical advice. When you first start this technique, set a timer on your phone for 60 seconds. Most people significantly underestimate time when counting in their head, and you might think you've done 60 seconds when it's really been 35 or 40. Using a timer, at least for the first few weeks, ensures you're actually getting the full therapeutic dose. After a few weeks, you'll develop a natural sense of the timing and won't need the timer anymore. Also, this entire practice costs essentially nothing. A bottle of castor oil or coconut oil runs about $8 to $15 and will last you months. Compare that to the ongoing cost of medications, which can run hundreds of dollars monthly even with insurance. This technique represents one of the most cost-effective interventions available for male sexual health. There's no ongoing expense, no side effects, no complicated equipment, just your time and consistency. Now, I want to acknowledge that for some men watching this video, the underlying cause of erectile dysfunction might be primarily vascular or hormonal rather than neuromuscular. If you have significant cardiovascular disease, uncontrolled diabetes, or severely low testosterone levels, this massage technique alone won't resolve your erectile difficulties. It should be part of a comprehensive treatment plan that addresses those underlying conditions. Get your testosterone checked if you haven't already. Make sure your cardiovascular health is optimized. Control your blood sugar if you're diabetic. Address sleep apnea if that's present. This technique works best when the foundation of your overall health is reasonably solid. It's not a substitute for addressing serious medical conditions, but it's an incredibly valuable complementary practice that enhances whatever else you're doing for your health. As we close out this discussion, I want to leave you with one final thought. Sexual health is an integral part of overall health and quality of life. It's not vanity or selfishness to want to maintain or restore erectile function. It's not something to just accept as an inevitable part of aging. While some decline is natural, significant dysfunction usually indicates correctable problems with blood flow, hormones, or neuromuscular function. Taking action, whether through this massage technique or other evidence-based approaches, is an act of self-care and self-respect. You deserve to feel vital and confident in this area of your life, regardless of your age. So here's my challenge to you. Commit to this 60-second daily practice for the next 30 days. Get a bottle of castor oil or coconut oil today. Start tomorrow morning after your shower. Set a calendar reminder if you need to. Track your practice daily. Notice the changes, subtle at first, that begin to accumulate over those 30 days. Then come back and let me know in the comments how it went. What improvements did you notice? What challenges came up? Your experiences help other men who are watching and trying to decide whether to give this a try. We're building a community here of men who are taking charge of their health with evidence and common sense rather than suffering in silence. Thank you for watching, and I'll see you in the next video.